Hi, we're going to talk about the use of cannabis with seizure disorder patients, otherwise known as epilepsy, more commonly. And this has received a lot of big press recently in the past few years for children, especially children that have specific genetic diseases that their epilepsy is not managed very well by common medications. And in fact, the FDA has approved the first cannabis federally approved drug in the United States for use of these children with seizures. It's called Epidiolex. And it's providing great relief. It's actually helping some children where nothing else has been useful. So we're really grateful for that. And this is a highly strong CBD-rich medication. It's like 99% CBD or more. So we're not putting THC into kids. In fact, THC has been shown to be useful for seizures before CBD ever came around. Back in the 60s and 70s, THC and THC acid and CBD acid and various other cannabinoids have been shown to be good as anti-epileptic molecules. So in future research, I hope that they start bringing in some of these THC acids, CBD acids, in addition to CBD, especially for children, because none of those are psychoactive. And it might help to reduce the very, very high dose you have to use for epilepsy with cannabis. You have to go up to hundreds or several hundreds of milligrams a day of CBD-rich cannabis to control epilepsy. As far as adults are concerned, I don't really recommend that adults whose epilepsy is well controlled by their medication switch to cannabis because it's a complex procedure, should be professionally managed. As I said, you're going to have to go up to many hundreds of milligrams a day, which is costly and may not be as effective as your medications. So when the medicines are working, don't change them. If your medicines are not working, then as an adult, you do have the option of adding any of those cannabinoids I mentioned. CBD, THC, THCA, CBDA, combination of all of the above. And as an addition, you might not have to use hundreds of milligrams a day, but you might actually have to use 50 milligrams 3 times a day or more. So this is an ongoing treatment that is very significant. You don't want to miss a dose because you don't want to have a seizure.